Hello everyone, welcome to our booth from the University of Texas Health Science Center at San Antonio. This is our dental school and it is home for all dental specialties. In this presentation, you will hear about the program, facilities available, the kind of relationship we have as residents with our faculty members, as well as get some exposure to the breadth of clinical experience we are exposed to in this prosthodontic training program. These images show our lab benches where every resident is assigned a seat to work in the lab during or after our clinic sessions. A lot of the learning happens in this place, as the residents share knowledge and technical skills to help excel our cohort with what we do. There is also 3D printers in the lab, and we use those printers to print prostheses and appliances like complete dentures, surgical guides, full coverage provisional restorations, and more. These are images of the wet and dry sides of the lab. The left image here shows our denture processing area where we heat process and post-process acrylic complete or partial denture prostheses. On the right side, we can see our casting area where we are able to cast different kinds of frameworks and full coverage restorations. We utilize a studio set for our laboratory photography as well as extraoral photography. We utilize these studios to acquire photographs that are of very high quality, as you will see in the coming case presentations. At our program, a master's degree is optional. There is a big variety of possible projects to take on, and it is not difficult to find a project that you would be interested in researching and providing scientific evidence about. The left panel on this slide shows some examples of projects that some of our graduates have taken on and been able to successfully defend. In our training program, we have several opportunities to present posters about our clinical or research experience in several conferences and meetings like the annual meetings of the American College of Prosthodontics, American Equilibration Society, and International Academy of Gnathology. On a monthly basis, 2 of our residents are assigned a rotation in Laredo, Texas, where they would provide removable prosthodontic treatment for patients in an underserved area with the support of a faculty member that would also be assigned on the same trip. These trips really allow for a great team building experience clinically as well as personally after the clinical sessions are over. These rotations last from Wednesday until Friday of the assigned week. It is always good to see some of the faces involved in our training program. Those are some of our faculty members who support us in our treatment planning, execution, and discussions. Dr. Taft in the top middle image is our program director, past president of American College of Prosthodontics, past president of the American Board of Prosthodontics, and past president of the American Academy of Prosthodontics. Dr. Haney and Dr. Lamb on the top corners of the slide are our previous program directors who remain currently as faculty members. And this is us. On average, there is 4 residents accepted in our training program per year. We have a great relationship with each other, and there is a lot of camaraderie between us. Our training program places a good amount of emphasis on board certification. As a result, we have multiple mock board exam experiences that would train us for the different parts of board examinations, including the written and oral exams. This room holds many of our meetings that are geared towards interdisciplinary care. Every Wednesday morning, an assigned resident from a specific department presents some of their clinical experiences to all other departments. Presenters can ask the audience questions to help them achieve a predictable outcome and learn more about what other specialties think with regards to specifics of the presented case. So let's talk about some cases. This is a bulimic patient who presented to our clinic for rehabilitation. In the frontal intraoral image, we can appreciate the amount of wear caused by opposing ceramic material that was facilitated by acidity of the mouth. The patient was planned for maxillary and mandibular hybrid restorations. Initially, a wax-up and fabrication of maxillary and mandibular immediate dentures is done. Duplicates of these dentures in clear resin would be used to guide the implant placements non-restrictively. Here we can see the implants placed and the converted immediate dentures into interim hybrid prostheses. Here we can see the fabricated maxillary milled bar with the fully fabricated prostheses on the right side, and this is an image of the prostheses delivered in the patient's mouth. This is another case that was planned for a maxillary overdenture, also known as a Marius bridge, opposing a mandibular hybrid. Implant placements were guided via a milled chrome alloy guide for stability and strength. These images show how Marius bridges work, and that is through a pair of posterior piston attachments that engage the denture into the bar, as seen in the lower left image. These pistons can be disengaged via a key that fits into a small hole in the buccal side of the prostheses. This is a rehabilitative case that was also planned digitally for orthognathic surgery. From the top left corner, we can follow the workflow that our resident has performed on this case. From data acquisition to a diagnostic wax-up of the case, followed by digital planning of the appropriate skeletal relationship and guided by his own wax-up. As prosthodontic residents, one of the common cases that we see is full mouth rehabilitation that is needed to restore extensive tooth substance loss that is secondary to dental wear. This image shows the progression into bonded composite resin overlays that takes the patient to the new proposed occlusal vertical dimension. This is then followed by the preparation of the dentition, provisionalization with full coverage restorations, and then followed by delivery of the final full coverage restorations following equilibration and aesthetic approval from the provisional crowns. Here are some more images of the final restorations. And this is a photo post-delivery of this rehabilitation. We see a number of maxillofacial cases in our program, like this patient who had a tumor resection and who we designed an obturator RDP prosthesis for. The patient was thrilled with his improved aesthetics and function. We are also able to use digital workflows to restore our removable patients, including this patient who required immediate dentures. We are also able to use our lab scanners to go ahead and scan the patient's models. Then the patient is digitized and tooth position was established by overlaying digital models with the patient's facial scan. Denture bases were designed and printed along with teeth using our in-house printers and luted together to create efficient, economical, immediate prostheses for this patient. And these images show the patient post-delivery in 24 hours on the left and after 1 month on the right side. Thank you very much for visiting our booth. If you have any questions, please let us know.